How is infertility treated? In vitro fertilization, IVF, is the most well-known fertility treatment, but there are other treatment methods that can be recommended for couples who have difficulty conceiving naturally. The decision on which method to recommend is made after the condition of the woman's fallopian tubes and egg quality and the man's sperm evaluation, accompanied by information such as the age of the partners, whether there has been a previous pregnancy, how long they have been trying to get pregnant, pregnancy, fertility, drugs. If the fertility problem is due to a lack of regular ovulation, fertility medication in the form of tablets or injections can be used to stimulate ovulation. While the treatment given in the form of a pill allows the natural fertility mechanisms in your body to work more effectively, the treatment given in the form of an injection stimulates the ovaries directly and causes ovulation. Possible side effects during medication may include hot flushes, breast tenderness, nausea and emotional fluctuations, while allergic reactions are rare with injection therapy. Pregnancy, fertility, treatment aimed at increasing the number of eggs may increase the risk of multiple pregnancies and, in rare cases, ovarian hyperstimulation may occur. It is very important that pregnancy treatment is carried out under close supervision to minimize possible side effects. These drugs, which regulate and increase ovulation, are also frequently used in other pregnancy treatments. Vaccination therapy, insemination. Vaccination treatment is a simple method of inserting your partner's sperm into the uterus during ovulation when fertility is at its highest. This method is recommended in cases where the tubes are healthy and the cause of infertility is unexplained. It is also used effectively in couples where the sperm count or motility has decreased to very low levels, the passage of sperm through the cervix is prevented or sexual intercourse cannot take place due to reasons such as vaginismus, premature ejaculation, erectile dysfunction. The most motile sperm selected from the sperm sample given by your partner and the sperm with the highest probability of fertilizing the egg are passed through the cervix with the help of a plastic tube and deposited into the uterus. Vaccination treatment is not a painful method and is usually applied together with medications that support pregnancy formation. The success rate of the treatment is approximately 15% and varies according to the age of the woman, the sperm values of the man and the health status of the tubes. In vitro fertilization, IVF treatment. Women with regular menstruation produce a single egg every month. IVF treatment aims to increase this number with hormone medications given externally. Although each treatment protocol varies, basically two parallel hormone treatments are applied, one to promote egg development and one to prevent premature ovulation. Determining the number of embryos to be transferred can directly affect the chance of pregnancy and the risk of multiple pregnancy. Once the embryo quality has been determined, the number of embryos will be discussed in detail with the couple before transfer. Embryo transfer does not require anesthesia except in very rare cases. Surgical methods in infertility treatment. Some surgical interventions before IVF treatment increase the chance of pregnancy. Treatment of endometriosis. Removal of fibroids or polyps that disorganize the lining of the uterus. Opening of intrauterine adhesions. Removal of blocked and enlarged fallopian tubes in which fluid has accumulated. Surgical treatments for women with polycystic ovary disease and suppressed ovulation. Surgical removal of sperm from the testis, teats, tesa, or epididymis, mesa, pes, in men without sperm. Laparoscopy. With laparoscopy, instruments inserted through 3 to 5 mm holes in the lower abdomen can be used to directly observe diseases or problems involving the uterus, ovaries and tubes and, if necessary, surgical intervention can be performed. The conditions in which laparoscopy is applied are as follows. Intra-abdominal adhesions. Opening the tubes. Removal of damaged tubes. Fibroid surgery. Chocolate cyst surgery. Hysteroscopy. A hysterectoscope is a tube-shaped device with a camera at the end. It is inserted into the vagina and extends from the cervix to the uterus, allowing the doctor to detect intrauterine problems. Your doctor can take a small tissue sample if necessary. By visualizing the uterus with the hysteroscope device, problems such as fibroids, polyps, and intrauterine curtains can be diagnosed and treated with simultaneous intervention. Here are the conditions in which hysteroscopy examination is performed.